All right, well, good evening. One of the things that we are finding is that lack of information creates more anxiety than information itself, and so we probably will err on the side of over-communication. But after the announcement went out that there were two presumptive positive COVID-19 patients, and one of them came from Wayne County, Dr. Caldoun has assured me that that individual was not a resident of the city of Detroit. So we don't have COVID-19 in the city of Detroit yet, at least not that we know of, but it is inevitable. And so it's not a reason to panic, but there's every reason to be prepared. And so we've assembled a team with Beth Niblock overseeing our overall emergency response, and the team that's here with me, Denise Fair, our health director, Hilton Kincaid, the emergency management director, Hakeem Berry, our chief operating officer, and Gary Brown, who runs the water system. This virus will stop spreading when we start being responsible to our neighbors. The average COVID-19 patient spreads the virus to 2 to 3 people. That's how it's spreading. And the symptoms by now are well known. They are a fever, a cough, and shortness of breath. If you have a fever, stay home. It's the single most responsible thing that you could do. And if people who had these symptoms stayed home, this outbreak would be brief. The problem, of course, is being caused because people think there's something so important that they should risk their neighbors. We have a responsibility to our neighbors. If you know somebody in your family that's got a fever and a cough, tell them to stay home and don't get too close to them yourself. I applaud what Governor Whitmer just did in encouraging gatherings of more than 100 not to occur. Because while the average COVID-19 patient can infect 2 to 3 people, if that individual's in a large crowd, it gets even worse. And I'm very pleased that the organizers of the St. Patrick's Day Parade have agreed to cancel the parade this Sunday. It wasn't something that was done lightly, but what the evidence is showing so far is while COVID-19 can be transmitted through handshakes or surfaces, it appears that the great majority of the cases are being transmitted by coughs and sneezes, the droplets in the air, people within 3 to 6 feet of each other. You think about the St. Patrick's Day Parade, all those folks standing shoulder to shoulder for hours, it was a recipe for the spread of the problem. And I'll echo the governor's comments that companies and groups need to think carefully about how important a gathering is and how closely the people are packed into that gathering. Because if we stop this, it will be forgotten relatively quickly. 2 people out of 10 million in the state of Michigan right now. But those are the things we need to do. Let me tell you what we are doing here in addition. We have now partially opened the Emergency Operations Center, not because we have any cases, but because we expect that it's likely a matter of days. And we want to be up and running when that happens so we can respond to whichever address or location there is. And the state's process is, if it's in your community, they share it with you. If it's not in your community, they don't. So I actually don't know the 2 cities that the individuals were in. I just know they were not in the city of Detroit. I want to thank the board of the Great Lakes Water Authority today. They unanimously approved our request to double the funding for the Water Assistance Program, which will take it from $2.5 million to $5 million a year. Our $25 water program appears to have caught the interest of people across the state and across the country. We have cities around Michigan and around America calling to see how we did it, and they're addressing the same problems we are. If you do a complete moratorium, your financial system collapses because people who can pay stop, but if you charge people too much, you run the risk that you have individuals very much in need of being able to be germ-free not being able to do it. The $25 program means that every single person in the city of Detroit can afford to keep their water on, and with the governor's help, we're paying that first $25. We started this morning, and by early afternoon, we already had 300 people in the program, 139 who had water shut off that we are already sending crews out to restore. We don't know whether all those houses were occupied or whether people had moved out of them when the water was shut off and they're turning it on to move back. But we know that we have 139 that we're in the process of restoring. We had another 261 who had gotten their shut-off notice, who are now getting in the $25 payment plan, and that shut-off process has stopped. That was just the first day, and with the Great Lakes Water Authority funding, we now are funded for several months into the future, and certainly we will be able to do this through as long as this continues. The other thing that we did today is that we have set up a medical response team within the city. There are companies that can say to their employees, stay home and work from home. City government can't do that. City Hall serves people. We're police officers and firefighters and EMS workers and bus drivers and people who are running the permit office and the tax office and the animal control officers. The nature of our business is that we have to keep interacting with the public. And so it is my responsibility to do everything possible to protect the health of the city employees while those dedicated employees continue to do their jobs. And so we have taken a number of steps to deal with that. We've had a lot of internal communication with our employees, and today we formed a medical response team headed by the health department and staffed by our EMTs. And our EMTs, of course, are used to dealing with communicable diseases every day. They do it day in and day out, year in and year out. But if you're a city employee and you think somebody close to you may have been exposed, talk to your supervisor. We'll have our medical response team come out and talk to you right away, reassure you, and follow up. If somebody in the workspace appears to have a fever or a cough, we'll call the medical response team, and they will come out and evaluate you, get you to a medical facility promptly. And in the event it turns out a city worker was exposed, the medical response team will follow up with anybody else in that working area to make sure that it has not spread. We have not had any of these instances. What we are doing is not panicking. We are preparing. But that medical response team will be in place in the morning to protect the 9,000 employees. We are also asking members of the public, please don't come to city facilities if you're running a fever or you have a cough. We will be posting signs along those lines. If you have something that's an urgent need, you've got a tax issue, a permit issue, or the like, call the office, and everybody is being instructed. If there's any way to work out an adjournment or a solution over the phone, we are going to attempt to do that. But we don't want to be exposing you or the other people sitting in waiting rooms. We have to be responsible to each other. And finally, to our employees who may get up tomorrow morning with a fever and say, I'm out of sick and vacation time, I have to go to work. I've asked Denise Starr, our HR director, that if we have cases where people are genuinely concerned about being contagious and are out of sick and vacation time, our HR department will step in. They've got the authority now to make certain that the HR rules are not a reason that you have to come to work. Everybody's health is more important than those rules, and Denise is committed to making sure that everybody is treated fairly. So we will continue to update you. I have no doubt there's going to be a point at which we're talking about the follow-up of a family where there is contamination, there is a disease, but we don't have that yet. And with that, let me turn this over to our health director, who's done an absolutely outstanding job working closely with, of course, our former health director, Dr. Khaldun, who's at the state level, Denise Fair. Denise?
Thank you. In light of the governor's message, which advises gatherings of more than 100 be postponed or canceled, it is important that our large venues and event organizers prepare as the COVID-19 outbreak evolves. To date, there are no confirmed cases in Detroit. The Detroit Health Department is recommending that all organizers prepare for the possibility of outbreaks in their communities, as COVID-19 is expected to last for a long time. One of the best ways to prepare is to create an emergency plan for mass gatherings and large community events. I'm asking you to review your existing operation plans for emergencies for your venue and address key prevention strategies in that plan. Establish relationships with key community partners and stakeholders, such as the Detroit Health Department, for guidance. Taking these steps will protect you, the health of your event and participants, and the local community in the long haul. For smaller events of less than 100, or venues planning to continue their festivities, hygiene products like tissues and hand sanitizer of at least 60% alcohol should be placed in all common areas. Common areas should be cleaned often, and restroom facilities should be stocked appropriately and cleaned often. Video or live streaming events should also be considered. Guests should also practice good hygiene habits, including hand washing, avoiding touching your face, covering coughs with a tissue or sleeve. And as best as you can, try to keep a healthy distance between you and your neighbor. Finally, if you are sick, please stay at home. Everyone can do their part to plan, prepare, and respond to this emerging public health threat. Together, we can help slow the spread of this virus. Thank you.
And with that, we'll take any questions. So I have directed our staffs to review the cleaning schedule of every city vehicle, buses, police cars, the people mover, as well as all the common spaces at city halls and the rec centers. And Dave Masseron in the procurement department have acquired a significant amount of cleaning supplies, and I will get a report in the next 24 hours relative to city facilities and city vehicles on a more intense cleaning schedule.
Your Honor, are you preparing any worst-case scenario plans? Let's say police start calling in sick, EMT, first responders. Given that those people are already working a lot of overtime now, it doesn't seem like you can stress the people who'd be left very much more, or replace somebody for these positions that require certification, training, and things like that.
Eric Jones. So let me say this. So I'm in contact with my colleagues in Seattle, in Los Angeles, in Boston that are much farther along, and we're keenly aware of what's going on. It's the interesting thing about first responders. On a daily basis, they're interacting with people with tuberculosis, with HIV, and the like. They have a different preparation level than most of the rest of the public. We have not seen signs of people calling in the bus department as well as the others. So that hasn't been the trend you've seen nationally, but we have a protocol which everybody is updating. That is, you call it the continuing, what do you call it, Hilton?
Continuity of operation plan.
The continuity of operation plan, or the COOP as they call it, where everybody has a plan. Usually the plan is huge spill, nuclear bomb, whatever. Every department is updating their continuity of operation plan to say what happens if people can't come to work, don't come to work, and they are all due with their operation plan. They're well underway, most of them are in, but they will all be in place. So we're giving a great deal of thought to that, and the plans will be in place well before we need them. But we do have the advantage that some of the cities on the coasts are way ahead of us in the curve, and we are going to continue, the mayors in this country are very close, continue to share with each other what's happening and share strategies that work. And they've been calling us because they wanted adopt our $25 strategy on the watershed house, and we will be talking to them about what they have to do relative to any problems with workers showing up for work.
Get in contact with any faith leaders who, run larger congregations, 1,000 plus a few mega churches in the city.
Yeah.
In contact with any of the faith leaders about, canceling Sunday gatherings, et cetera.
We will be reaching out tomorrow in light of the governor's recommendation, which came out about 30 minutes ago. And there's going to have to be some conversations about what happens. Some of the NBA teams are leaving seats open to space them out. And so we don't have a right to order folks what to do, but I think the ministers in this town have, deep level of responsibility. So we're having those conversations tonight and tomorrow, and ultimately it'll be up to the individual ministers to make those decisions.
Your Honor, are you anticipating an increased impact on city services, demand for city services, particularly for people who may be the vendors at these stadiums when events are canceled, people who may be waiters or waitresses who may be laid off, if people stop congregating and doing larger events? Because we do have a lot of people who are hourly workers working from paycheck to paycheck. If those jobs dry up,
Right.
the city seems like a logical place for them to turn for help.
So it's a major issue nationally. I mean, airline employees right now are in serious difficulty. If we were to have a problem at one of the casinos, you could see a lot of people unemployed. But that's not any different than what every city in America is dealing with right now. And so we are watching it. And, I don't know whether we have a short downturn or whether we're heading into a recession. We've been financially preparing for that. And during economic downturn times, you're right, there's more demands for city services. We've put a lot of money away in the reserve. I wish we had more run time, but we'll deal with it responsibly.
And does the city have the capacity to deal with that? Is that something where you
Yeah.
turn to Washington and say, it's time to...
Well, I think Congress is talking about an $8 billion appropriation. I think the governor is now talking about something at the state level. And so we have two different questions. Right now, my focus is, let's make sure there's enough test kits to deal with the medical issue, and let's make sure we can respond to that. And then second, we're going to have to deal with the economic consequences as a country. And it's something all mayors are talking to, and I'm talking to our congressional delegation, been talking to them today about that. And so I'm not telling you it's not a problem. We're going to deal with it as it comes.
The schools, have you talked to Sergeant Beatty?
Again, the schools are going to have to make their own decisions. They've got guidance from the state of Michigan. You've seen a number of the universities where their students are on laptops who are making choices. But you'll have to ask Dr. Beatty about his conversations with the state health director.
You talked a bit about test kits. Will the health department be taking samples from people so that they can be tested somehow and send that to state labs? Or...
Yeah, if a doctor identifies somebody as a presumptive positive, and usually it's not the symptoms. The symptoms of COVID-19 are very close to symptoms of flu. Usually it has to do with your travel history or history of somebody close to you who's had COVID-19. But there is a protocol on how those tests get there. And I think Dr. Caldoun said earlier today they're running tests 7 days a week. But everybody has a protocol on how to get tested. I am concerned nationally whether there are enough test kits to keep up if the numbers, the trend lines continue. And that's a national question. We haven't hit the limit yet, but it's certainly something that's on my mind.
What's the total funding for the water restoration program?
It went from, the water assistance went from $2.5 million a year to $5 million a year. So,
That's thanks to a grant today from the Great Lakes
so Gary Brown, who is our lobbyist, I'll let him talk to it because he got it through today.
Thank you very much. And so the RAP program had been funded by 0.5% of the annual budget of the Great Lakes Water Authority's budget. And they allowed Detroit, and Detroit only, to increase its budget from 0.5% to 1%, which totals $5 million. So currently we're sitting on $1.3 million. Last week, the Great Lakes Water Authority reallocated money that went unspent in Oakland and Macomb County to Detroit. They reallocated $1.5 million, $500,000 to the city of Flint and $1.1 million to the city of Detroit. So we have about $2.5 million we can work with today, and in July we'll receive a new allotment of approximately $5 million. And so that's important, but what is also important is that the governor is allowing the water department to leverage state emergency relief funding to augment the dollars that we have to be able to go into homes and make the repairs necessary so that when we turn the water on, our customers will be getting an average bill and not an inflated bill because they have plumbing issues in their home. So we want to thank the governor for allowing us to tap those funds, and also thank Warren Evans and the other Great Lakes Water Authority board members for reallocating dollars that went unspent in Oakland and Macomb County to where the real need was, the city of Detroit.
So what time was that meeting, Gary?
Today, the meeting was at 1 o'clock, and we got it done about 4 o'clock this afternoon.
How many residents are still without water?
Well, that's a great question. We received 1,900 phone calls today, the first day that we're receiving calls, and we were able to process about 500 of those. 167, I believe, is the number that we're going out to turn the water on today or tomorrow, and the rest have been able to avoid a shutoff by calling and requesting the help. And, you know, I just want to be clear that every single Detroiter has an opportunity not to see a disconnection if they simply ask for the help. This program is geared toward the people that are currently out of water right now, but we still have the RAP program for low-income customers, as well as the 1030/50 program for Detroiters that don't meet the income requirements. We can put them on a very reasonable payment plan. So every customer has an opportunity not to see a service interruption if they simply come in and ask for the help. And if you're shut off now, come in and make the phone call, make the appointment, and we'll be out to get your water on the next day.
All right, thank you all very much.